सर जी सर जी
Good morning. Do you hear me okay?
Good morning, Director General.
Good morning,
See you.
Dr. Isra. How are you?
I'm fine, thank you.
Okay, thank you very much
Good
for
morning,
joining.
Horen.
Can you hear me now?
Dear.
Okay.
Good afternoon from Philippines. It's already 1 o'clock in the afternoon. Good afternoon, sir. Good afternoon to all of you.
Good afternoon now. Afternoon in Philippines.
Yeah, it's 1 o'clock in the afternoon.
All right.
Good morning.
The internet in Bangladesh is not so good. So from time to time, it will be interrupted, I think. Yeah.
Hello. Now I'm going to start our today's webinar. Good morning, good evening, good afternoon, everyone. We are going to celebrate the International Day of Rural Women. This day was celebrated in October 15, but CIRDAP is organizing this webinar today. So I'm your host and facilitator, Zurain Zannat, Communication Officer in CIRDAP. Here is our CIRDAP map and our beautiful building, two-storied family house. To visit our building. CIRDAP was established on 6 July 1979 with the initiative of Food and Agriculture Organization, FAO. And we have 15 member states, you can see in our map. Now I invite and welcome our Honorable Director General CIRDAP, Dr. Charsak Virapad, to give his remark and message. Sir, over to you.
Good morning, Excellency, technical committee members of CIRDAP, distinguished participants, colleagues, ladies and gentlemen. Today, we celebrate the International Day of Rural Women at the Center on Integrated Rural Development for Asia and the Pacific. The day of 15 October was established at the United Nations General Assembly of 18 December 2007, recognized the critical role and contribution of rural women in enhancing agricultural and rural development, improving food security, and eradicating rural poverty. On behalf of CIRDAP, I call for global attention on gender equality commitments and contribution of rural women to development. CIRDAP is proud to organize a webinar to celebrating the International Day of Rural Women today. The webinar is also part of the webinar series of CIRDAP in 2022. The webinar will be presented by Dr. Usharani Boruah, Librarian, and also coordinator of gender on Integrated Rural Development Program. Her title of presentation will be on SDG 3, Good Health and Wellbeing, the situation of rural women. The theme for the International Day of Rural Women this year is on rural cultivating good food for all, highlights the essential role those rural women and girls play in the food systems of the world, from production of crops to processing, preparing and distributing foods. Women's labor, paid and unpaid, feeds their families, communities, and the world. Yet they do not wield equal power with men, and as a result, they earn less income and experience higher food insecurity, despite our planet's capacity to provide sufficient and good food for all. Hunger, malnourishment, and food insecurity are rising in many parts of the world. The COVID-19 pandemic, along with climate crisis, have made matters worse. Some 2.37 billion people did not have enough to eat in 2020. That's 20% more than the year before. It is important to note that under the SDG 3, ensure healthy lives and promote well-being for all at all ages, and SDG 5, achieve gender equality and empower all women and girls. We will need to ensure regular and nutritious food to promote and maintain good health for all, and to ensure women's full and effective participation and equal opportunities for leadership at all levels of decision-making to promote the empowerment of women. Ladies and gentlemen, finally, I would like to thank Dr. Usharani Boruah for her contribution to this webinar to celebrate the International Day of Rural Women in 2022. I wish you have a great success on your deliberation. Thank you very much for your kind attention. Back to you, Huren.
Now, some of the glimpses of the upcoming webinars, like we will going to have some. Sir, can you hear me? Hello? Hello, sir, can you hear me?
Internet in Bangladesh is on and off sometime. It's difficult to have an effective communication sometime. Anyway, Huren, are you ready?
Yes, sir. My internet was go down.
Okay, all right.
Okay.
Now I finished my message already, so please.
Okay, thank you, sir. Thank you, sir. Now I want to show some of the glimpses of our upcoming webinars. So we will going to have these webinars in our in quick. One is on World Soil Day 2022, Biodiversity and Wildlife Conservation, by one of the distinguished professor from US. Another webinar on good governance, need and role of social accountability tools. And then another webinar on role of youth and rural development, and climate smart and water management. Now we are going to organizing our presentation on this day. This year theme, Rural Women, Key for a World Free from Hunger and Poverty. So today's webinar title is SDG 3, Good Health and Wellbeing, the Situation of Rural Women. So I would like to say something about our today's speaker, Dr. Usharani Boruah. She is currently working as a librarian and program manager, gender in integrated rural development of CIRDAP. She born and brought up in Assam, India. After completing her higher secondary education, she went for higher degree in Russia. So she completed her master's and PhD degree from Moscow State University of Art and Culture. Before joining CIRDAP, she has worked as a librarian in various organizations, for example, Apollo Hospital, Jagannath University, Central Indian School, Moscow, Russia, UTA, Dhaka, Embassy of India in Moscow, and also in Bangladesh. So to know more about her and her work and her publication, you can visit our expert.cirg.org database. So before moving to our presentation, so I would like to request all of you just drop your name, designation, and organization in chat box. And if you have any questions, suggestions, and opinions, also you can drop in chat box. And after finishing the presentation, you can directly ask to our speaker. And I'm requesting all of you kindly switch off your microphone while you are not talking. Now you can follow our Facebook, LinkedIn, and Twitter page, and you can also visit our website. Thank you all. Thank you for listening me. And now I invite Dr. Usharani to start her presentation.
Ladies and gentlemen, I'd like to request you to kindly unmute, mute your microphone, please.
Respected DG sir and honorable participants, good morning. Sunday to hindi ko na makita.
Dr. Usharani, kindly wait for a minute. I request communication officer to inform our participant to mute their microphone, please. Okay, you may.
Yes.
Dr. Usharani, please proceed. Thank you.
Okay. Thank you, sir. Thank you so much. Good morning, sir, and good morning, dear participants. Now I am going to present my presentation today. My presentation title is SDG 3, Good Health and Wellbeing, the Situation of Rural Women. What is good health? Good health is a state of being vigorous and free from bodily and mental disease. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. We are telling health is wealth. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. This is the full definition. Why is well-being important? Well-being is fundamental to our health and overall happiness. Having a strong and well-adopted sense of well-being being can help us overcome the difficulties and help us achieve our goal in life. Well-being reflects the increased physical benefits such as lower incidence of cardiovascular disease, stroke, and sleeping problem, and with increased productivity and creativeness in both employment and personal life. How do I increase my well-being? Well-being is a holistic approach. We must look after all the aspects of our lives if we wish to increase our well-being. Enhancing your well-being is not always easy, but it is always worth it. Eating a healthy food, diet, getting enough sleep, exercise, physical exercise, creating healthy habits to look after your physical health are some of the easiest way to help develop your sense of well-being. Now, SDG goal 3 aims to ensure good health. Life and promote well-being for all. At all ages, health and well-being are important at every stage of one's life, starting from the beginning. This goal addresses all major health priorities, for example, reproductive health, maternal health, newborn, child and adolescent health, communicable and non-communicable disease, universal health coverage, and access for all to staff, effective, quality, and affordable medicine and vaccines. In rural area, women and what type of difficulties women are facing? First of all, maternal mortality. In rural area, maternal death approximately 803 women die from preventable cause-related pregnancy, childbirth. This is the prevented. Maternal mortality is much more common in rural areas in Asia Pacific region. This is the data from WHO. 85,000 pregnancy women are every day they are dying from pregnancy-related complications. Another problem is maternal health. Mental health. Nearly 1 billion people live with mental health continue across the globe. Before COVID, many of youth in the Asia, many rural youth are suffering. This number have risen significantly since the start of the pandemic. Other populations that see high rate of mental health condition include, for experiencing homelessness. Mental health challenges can also impact a person's family and peers. Many people in the Asia provide care to an adult with mental and emotional health issues, spending around a lot of hours a week providing unpaid care. What is it targeted? There are 13 targeting. You can go to the website and you will get everything. Just I want to tell some of them. By 2030, reduce the global maternal mortality ratio to less than 70. For Friend, dedication. Presentation the Bible. Hello. I'm very sorry. There's an internet problem here. Now I'm starting. Less productive right. Women in rural areas who are in the less reproductive right in conservative and slow changing to give them permission to go for the paternal care and delivery and to seek family planning services. Rural women and girls are also vulnerable to the perpetuation of a harmful practice such as child marriage, bride kidnapping, and widow abuse. And migrant women. During Corona lockdown, migrant women mainly coming from various countries, mainly they are rural women who cannot come home, are giving birth on the street and relying on the cloth and ash. Since the announcement of the lockdown, who are working in the Middle East came back to their own country. They have lost their job and come back home without money, with poor health and stress. rural women effect of disaster. When the disaster strike, affected farming families often lost all their productive assets, leaving them unable to continue providing for themselves and leaving them totally dependent on external assistance for food, shelter, and other essentials. Women more vulnerable than men to natural disaster, conflict, and other usually have less access to productive assets like land. Tropical storm, cyclone, and monsoon flood are recurring events in Asia and Pacific region. Nowadays, all of you know that the Pakistan flood. This also affected rural women in Pakistan. On the international rural women, we salute them feeling loyalty and commitment in society. Let us come forward together and give them the honor and dignity they rightly deserve. We salute the rural women who are providing us food and all necessary productive essential good for us. Thank you so much.
The moderator.
Thank you very much. If you have any question, please tell me.
I think that first of all, I'd like to apologize the participant for this internet effectiveness in Bangladesh. It's come in and out from time to time during this period because there are so many, probably some kind of repairing of the cable. Do you hear me okay? Participant, do you hear me okay?
Yes, we can hear you.
All right. Okay. I suggest maybe it's better not to provide a video camera. Maybe we just so that to reduce the load on the internet. So now I'd like to ask Ms. Huren Janet to coordinate to moderate this webinar, please. Any suggestion, a question, please? Or do you? Someone told me that they did not hear the presentation because the internet problem. You have question, please.
Director General, this is IRDP expert Dr. Mohammad Israr, and I would like first to thank Dr. Usharani for giving us a nice presentation on the Rural Women Day, which is quite productive and quite touching upon various issues which the rural women are facing in developing and developed countries. First of all, I would say that basically there are different organizations like WFP, which is World Food Organization, and UNICEF, UN, International Children and Education Fund. I think if we could propose to WFP that most of the countries which are giving food items to are even the supply chain of the existing countries which are taking care of the food chains. And as Dr. Usharani mentioned, that food is deficient in nutrition. So I think if we could propose the food fortification for the member countries that the food which is supplied to the consumers, food fortification should be focused. And then if we are talking of the rural women, so you know that their dependency is mostly on agriculture sector. So the pre-harvest and post-harvest losses in agricultural crops are very high. And if those losses could be converted into processed food containing different items and constituents which can aid to their health. So I think with this way, we can go for nutritious food to the rural people and especially the women and children, which can reduce the retardation and the slow growth. So we will be having ensured good health of the women's as well as the kids. Beside that, the family planning concept was discussed, and you know that in most of the countries, like the religious taboos are there that they shouldn't observe the family planning. But I think keeping in view the health, the maternal health, and the health of the kids, the member countries should focus and should adopt a policy wherein we can persuade the religious clergy and the people teaching in the colleges, universities, and schools, that they can demonstrate and could convey the message of good health by adopting the family planning measures. Similarly, the health issues were discussed, and you know that in most of the developing countries, the patients' population is very high as compared to the doctors. So I think if we can give a suggestion from this forum to the member countries, that they can introduce the mobile health clinics, like for example, establishment of the hospital and the health facilities in each village and rural area is not possible for the governments because huge funding and budgets are required. So for that matter, I think the mobile health clinics would be of great importance. And for that matter, we can even approach from this forum to the WHO, World Health Organization, so that maximum people should have access to health issues. So these were some of the points which I just wanted to share with the participants. Thank you.
Thank you very much, Dr. Usharani, the IRD expert of CIRDAP. A very good suggestion on the World Food Program. We are thinking about communicating with this humanitarian agency to, especially during the climate impact crisis, on how we could help and facilitate them to bring supply of food and water to people in a remote area or in affected area. We will develop a concept and communicate with this agency in trying to provide an operation for this matter. And in terms of the mobile health clinics, I think this is quite a good initiative as well, but we need to identify the community or area where we could provide this kind of support, and that will need a kind of planning, mapping of area where people are located in different countries, and this may need some help of the country member to help identifying the area and community where we could provide this kind of support. So is there any kind of suggestion and question, please?
Can I make an intervention? I'm Dr. Binoy from South Asian University.
Yes, please. Please introduce yourself and then you raise the question, please.
Yeah, so I'm Dr. Binoy Goswami from South Asian University, New Delhi. So that's a very, the issue that we are discussing today, that's a very important issue, particularly in the context of our region, the Asia Pacific, particularly in South Asia. And one issue that from our research that we have found is that, for the rural women, as far as, and Dr. Boruah mentioned about the health of the rural women and the use of fuel, because, it's traditionally the women in the rural areas are responsible for, preparing food, and therefore the fuel that is used for, for cooking purpose or for other purposes, that becomes very important for health. And we know in this region, it's basically biomass and firewood that is used, and that's when we know that that is a problem that WHO and other agencies have also highlighted, how the use of the traditional fuel is detrimental to health of particularly of the women and the children. So keeping in view, so this is another, I think, issue that member countries should try that, how to sort of help the rural household to make transition from traditional fuel to modern fuel. And that, I think, is another important area of interventions that, Institute CIRDAP can suggest to the member countries. Thank you.
Thank you very much, Dr. Binoy. I wonder whether this kind of assist to rural household have been carried out by country member in the Asia Pacific region. Can you give example of India, please?
So in India, for example, we have, the government has introduced something called Ujjwala scheme. So I do not know the full form of, I don't remember, do not recall the full form, but it's basically about, giving subsidies to the rural households, and so that, they can have LPG connections. So that is one, and then households below certain income, they get that kind of subsidies. And from my own research in the context of Nepal, which I did in my university with my student, and we found in Nepal particularly that kind of issue. And there again, in our paper that we wrote on that, we suggested that we need to give some income support to improve the income so that they can afford better or modern fuel, because we cannot wait till the income increases and people on their own make transition, because by the time that proportion of the that the problem will assume huge proportion. So in India, yes, since you ask about India, so there is this program where you have this subsidy scheme where income households below certain level of income get for its connection. So but the problem here is, just now one of my students finished her MPhil work on energy poverty in India, and there we found that the scheme, though is effective in making the transition, that people get the connection, but because it is a one-time benefit, you get the connection, and therefore refilling the cylinder, it is expensive. And now in India, it is like market-driven price. So therefore, at times, the result is not as desired as it was initially imagined. So probably some continuous support will also be required. So I think from our experience, research, that much I can say, but this is a big problem, particularly for the rural women.
Thank you very much, Dr. Binoy. My point is that when you mentioned about this scheme, it seemed to be a scheme at the local level, and the national government should realize about this and be able to provide support.
Sorry to interrupt. This is not national level. Local level. This is a national program.
This is a national program.
Yes.
So that means that Indian government already know about the situation.
Yes.
And yeah, that's the reason that I think that the national government already look after this kind of problem. The only thing is that how can regional organizations like CIRDAP can support the national government. For example, in many places where we could identify the a poor community or a community in vulnerable area of flood or disaster. And in that case, that will be able to provide some information for government to make decision. You understand what I mean?
No, I get your point. I get your point. I was just,
yes.
Yeah, I get your point. Yeah.
All right. So in that case, we could be able to communicate with national government to look into localities and the available project to support community in remote area or in area where the government may miss out, and that will help support the national plan. Also, as I mentioned, in case of climate and disaster, that will be able to communicate with humanitarian agency to locate the area where we could bring about food supply in emergency and be able to help them during this recovery period. So this is something that the CIRDAP have in their mind of doing this. But you may advise further if we could work with the national government to bring appropriate technology or practices to help them in case that the national government may not have in place this program. Thank you very much.
Thank you. Thank you.
Thank you. Okay. Any more questions? We still have time, right, Huren? Okay, I saw someone raise hand from CDD. Please.
Hello, dear all. Greetings from Center for Disability and Development. Hope you all are doing well. I'm happy to see that, like previous years, from 2020, 2021, even at this year, 2022, CIRDAP is celebrated the World International Day of Rural Women Day. I mean, whatever the platform, like previous years, these years also, CIRDAP organizes such webinars for its members. So I'm Rakshi Boruah. I'm from Center for Disability and Development. I'm also a IRD expert of CIRDAP. So once more, thank you all. Although we just got a presentation, but due to technical difficulties, out of 25 slides, I think most of the slides are not audible whatsoever. I really sincerely appreciate that DG sir and the colleagues at CIRDAP, you have continued your efforts to recall this this day and to promote the significance of this International Rural Women Day, as well as International Rural Day. And this year we have seen on 26th of July, CIRDAP announces during its I think during its 25th years of celebration, CIRDAP announced 26th of July as the World Rural Day, right, sir? So
Development Day.
Was Rural Development Day, yes, sir. Yes, sir. So thank you again. So some of the suggestions I would like to make, and as you are asking, is there any examples from the member countries, significant examples that highlights these some examples that highlights the support towards rural women. The first of all, let me start with example. Very recently, just 2 months back, at one of our project location at Cox's Bazar, you know, in Bangladesh, we do have local government division, and with the local government division, we do have there is a separate wings are that rural what's a rural on rural development and cooperatives. And again, there's a state body that is named as Bangladesh Rural Development Board, BRDB. So at the Cox's Bazar districts, at the Ramu sub-districts, so BRDB, officials of BRDB, they came, they saw the events of CDD, organization that promotes equal participations and equality of persons with disabilities. So under there some ongoing projects, then and then Bangladesh Rural Development Board, they formed 4 groups that bringing together rural women and rural male, both persons with disabilities and persons without disabilities. And with the kind, they're compassionate enough after seeing and meeting these peoples, and they have understood the importance or significance of bringing together the vulnerable communities with the ongoing rural development activities. So they have formed 4 groups of that with the rural peoples and with the rural women, rural men, and persons with disabilities, both persons without disabilities. So we are pursuing with the government by giving these examples of BRDB and Cox's Bazar Ramu sub-district. So how to I mean promote these examples across the country, I mean across the Bangladesh, so that the other sub-districts where BRDB is working as part with the local government division of rural development, so that other sub-districts they can form similar groups where this marginal population can also come together. So this is one example. And some of my suggestion is wherever we working, be it India or at Philippines or at Bangladesh or Nepal or other CIRDAP member countries, I think one issue is important, that strengthening agencies of rural women, to make them empowered, to bring their voices, to amplify their voices. Otherwise, one single women, rural women, it would not be possible. So wherever we are working, be it as a part of intergovernment agencies like CIRDAP or in civil society organizations or academia, we should support and promote organization of rural women so that their voice can amplify. And I think that the men care approach, even it doesn't even need rural or be it a rural areas or the city area, even town, urban areas, with the women, the female of the person of a family, of a society. See, we have to shoulder lots of works, even after at the end of our office work, even at the urban area. So think about the rural women. So male care approach is needed. So the male member of the family, is the son, is the husband, is the father, they will come and support that the female member of the family. So they will shoulder some of our activities, be at home or whatever it is. And the thing is, in our ongoing rural activities with regard to empowerment of rural men and rural youth and rural women, think wisely, think more about this the population who are live behind all those marginal communities, person with disabilities or women with disabilities. See the Dalit communities, the transgender communities, the community, those are from ethnic minorities or indigenous community or people in terms of socio-economic standard, though those are very far behind this very limited financial, they are very limited financial skill or financial ability. So we have to think about them, think about the rural, among these communities, the rural youths, rural girls, rural males, these sort of things. And lastly, wherever we are, such events should be continued. And before finishing, I'm going to attend a conference that will be held at Cochin, Kerala, that would be on this rural, I mean gender issues and rural livelihood development. So another issue is how to she cope with the, how to she will fight to deal with her, I mean, these hunger and malnutrition issues if she has not enough IG opportunity, livelihood opportunity. So we have to think about her livelihood, available livelihood opportunity, or empowered her with the financial assistance wherever it is to deal her with these food and health issues. So that's what from me. Thank you all again. Thank you so much.
Uh,
Thank
thank-
you, Ms. Boruah.
Thank you. Huren, may I speak a little bit?
Yeah, yes, sir. Yes, of course.
Okay, thank you so much, Ms. Raki Boruah. Yes, I think that CDD has been a partner with CIRDAP, and we are working also to promote and support disability in rural development. And I think that to develop a kind like rural development board is doing to support sub-district arrangement. That will be a great initiative, because it means that you manage locality by a group of local people, and this kind of thing should be supported by the government as well in terms of financial support, and so that they could implement some works to support this many rural development agenda at the local level, because in many places the agendas may be different, and so that they can plan for their own development, and this should be supported by the government, and I support your this initiative by Bangladesh. In other country, I think that there should be this kind of practice as well. It's what you call to provide local organization to manage their own communities. When you mentioned about the gender in aquaculture and fisheries platform, which will be organized in Kochi, India, this year they organized the 8th session already, and they are a strong group of organization in Asia and in other region as well to work on gender issues, even though they focus on aquaculture and fisheries, but also they support gender in other area as well. So it is your great opportunity to attend this platform, and I hope that you bring about some good initiative and be able to discuss with those participants at the CAF 8, which will be held 21st to 23rd of November this year. CIRDAP will also represented by Dr. Usharani Boruah at the meeting. Unfortunately, I cannot attend this meeting, because this conference, because I will be not available due to the training program that we are having next month. So anyway, I think that you will bring about good things from CAF 8. Thank you. Back to you, Huren.
Yes, sir. Thank you, sir. And thank you, Ms. Raki Boruah, for wonderful suggestion and information. We have almost 27 participants in here, so we would like to hear from all of you. We have participants from Philippines. From Philippines, anyone can share anything or any suggestion on this day? If anyone want to share any suggestion, or if you have any questions for our speaker, you can directly ask.
Uren, I suggest that
Yes, sir.
you should provide the presentation of Dr. Usharani in the website also, because
Yes.
due to the internet,
Yes, sir.
few of people could not listen to the later part of her presentation. So we would like to have the PowerPoint also. And
Okay,
and I saw many comments in the chat.
Yes.
I think that maybe you take from that chat and to provide a response from the participant to Dr. Usharani. Thank you.
Okay, sir. Due to internet problem, we couldn't hear the whole presentation, but still, rural women is very, very important in the Asia and the Pacific countries. So participants can share their experience or any kind of work from their side. Like in the meeting chat, one comment from our expert, Mr. Alamin. Thank you very much, Dr. Usharani Boruah, for your informative presentation. If we look back to our past history, then we see that rural women are powerful, strong, and purposeful women who are deprived by the circumstances of abuse, inequality, and lack of opportunities. These challenges have hindered their personal development, economic empowerment, and community leadership. So irrespective of caste and creed, we have to work together, and it is the demand of time to emphasis on vulnerable rural women development and their livelihood. I hope CIRDAP will take effective initiative and will implement it by effective way. Thank you, our expert, Mr. Alamin, for your comment and suggestion. Of course, CIRDAP will work more because our director already take the initiative, and he started a program, Women and Youth program in CIRDAP. So with the coordinator of that program is our expert, Dr. Usharani. So we are also doing some work. We have also prepared a brochure on that program. So it's currently in a draft situation. So we cannot share it right now, but in future we will share it. So I see Dr. Wang Popo, if sir can say anything towards us or any experience he can share. Sir, if you can talk a little bit of if you can advise us.
I'm a man, so I can't say
Sir,
too much.
that should be more engaged with the women, sir.
About, you see, in Singapore, we are very egalitarian society, and you know, women and not, we are not an agricultural country, so there's very little role for what you call the traditional, where you find women, you know, play the traditional role, and you get you know, efforts to, you know, look into the efforts, etc., and question, you know, which are not raised. The type of question which are raised in countries like India, Pakistan, Sri Lanka, and many parts of the Asia Pacific country, a lot of these questions are not raised in Singapore because we are a very urban society, 100% urban. And the women, in fact, have equal opportunity already, you see. So this question never arose in Singapore at all right? So that's all I can tell you. In the women in Singapore, in fact, have a lot of power. The only thing we don't have is a woman, a female, what you call prime minister, but we have a female president already, you see. So they have equal rights. For example, the salaries are the same, you know, across all the government levels of employment. Maybe there's a little bit of difference in the private sector, but as far as I know, government many years ago have given them equal rights, you know, so no problem, you see. So I can't give any suggestion dealing with the rural sector. I can't, you know, okay. but it's interesting to hear some of these issues from the other countries. Thank you very much.
Thank you very much, Professor Wong Popo. I think Singapore in the past also rural area.
Oh, that
It's
was a long time ago, very long time ago, in the 50s when I was a kid, maybe 50s, 60s. But I think from probably 70s to the 80s, I think after 80s, no more. You see, the tremendous improvement was made, a big jump was made, I think in the 80s, the 1980s. That was the fastest improvement when most of us, the country just became urbanized totally. So now we are 100% urbanized. We look at the statistics, about urbanization. We don't have a rural sector. We don't have a rural sector. Sorry.
Right. You see, next month, I know that in the Philippines, there will be a discussion on assessment, global assessment of SDG. And they identify six key, I couldn't recall that words, but they use some kind like urban. One focus is on urban. The other one is on peri-urban, but they do not have rural in their assessment. I told them already, one of them approached me. I give them your name also. They may contact you for next month presentation in the Philippines. Yeah, and I told them that they need to have also rural components apart from the 6 focus, because they only have urban and peri-urban. There is no rural in the discussion, and in order to achieve the SDG, they need to include rural area as well. Yeah, so you will be in touch by the organizer of this. They organize in Manila, Philippines next month. Yeah, I can send you the information. They have a draft concept. Yeah.
Yeah, sir, permission to speak.
Yes, please.
Director Garesa of Philippines. Philippines now is very much aggressive in campaigning for gender and development. In fact, we have that gender equality and women empowerment plan, which the Philippines is now implementing until 2025. And as part of we all government agencies are encouraged, and it's really a mandate to all government agencies to incorporate in any proposal, training designs and program implementations, the participation of women in the different sectors of our society. In fact, for the Department of Agrarian Reform, where we are working, we are also encouraging the participation of women in the rural areas, because previously they are more on the working on the household activities, but this time we are encouraging, the government is encouraging them to participate in the training activities and the livelihood programs and other economic activities that will help them help the family improve their economic life, and also enjoy the participation in the social activities in the community. So this is a very good thing that our one of the government in charge, the Philippine Commission for Women, is now really taking part in the active advocacy that all government agencies. So it is now the movement of the government that to let the women empowered, including the children and the youth. No, in fact, there are some other bills coming out related to the youth participation of the youth sector, so that population can be controlled. There will be a little bit, we called it population demographic movement that will really help our country improve the economic and social life in the Philippines. And I'm very glad, I'm very proud that, yeah, thank you for that suggestions, that the women in the rural areas will also be included. And that is already been incorporated to the government agenda here in the Philippines. Yeah, thank you very much, sir.
Thank you very much, Director Ronel.
Garesa, sir, Garesa.
Our technical committee member from the Philippines. I just want to add, when I mentioned to Professor Popo, there will be a Global Sustainable Development Report 2023, Asia and the Pacific Regional Workshop, Consultation Workshop, 28 to 30 November, Manila, Philippines. And the term that I mentioned is the 6 entry points, which is identified in 2019. There are 6 entry points that focus on urban and peri-urban development, but there is no rural development. Just for your information. Thank you. We still have about 20 minutes for Q&A, please.
Sir, if you kindly permit me, may I reflect on another issue? Hello.
Yes, please.
Sir, our dear colleagues at CIRDAP, what if, let's say CIRDAP is working on rural population and rural development, and we do have International Rural Development Day, and I mean we have and the International Rural Day of the Rural Women. And what if can we organize at Bangladesh, at Dhaka, can we organize a kind of workshop or some consultation meetings, bringing the voice of rural youths and women? Because the days are being celebrated by us, the people from the rural areas, they are not included or they can't participate. What if we arrange some physical activity at CIRDAP? I mean, with the partners, I think we can help it we can be partner with you to organize such events to connect you with the rural populations. In that case, CIRDAP, you can, there is some strong evidence that CIRDAP is bringing together the community from the rural areas at the CIRDAP center. Because at the webinar and all those days, we are all these international speakers, so speaking in English, but my fellow country, male and females and youths from the rural areas, they can't participate here. Their presence is needed, sir. What do you think? Or what are the colleagues? What is your opinion, Dr. Usha and Brian?
Thank you, Ms. Boruah. I think that's a good idea, but it has to be from time to time, because to bring people to CIRDAP, it may need some kind of arrangement. Our role of CIRDAP is to link with people around Asia Pacific and also throughout the world through the web portal. We plan to communicate with them to what you call the connectivity, and request them to organize from their own places, so that we could have a worldwide movement in their own places to do activities in their local area. and that is the local initiative. For example, if we have how many countries in Asia Pacific, 50 countries, those 50 countries will organize on the same period of time or on the same day. And within the country, there will be communities, organization in that country. So you could imagine many organizations and community organized on the same place. And that will have an impact on the rural development. And that is our idea. We are in the process of developing the a web portal, and you will be part of that as the CIRDAP expert, also the CIRDAP partner. So you will be able to generate many activities to your networks and be able to link to us so that we could present on each day on who are working on these initiatives in different countries, in different locations. Your idea is good. We can organize from time to time to celebrate at CIRDAP, but we may not be able to bring all the people, but you may help us to bring those people. We have to plan in advance, let's say a year in advance, so that we could have a smooth organization of that event. Thank you. Okay, Huren, please.
Sir. Thank you.
Dr. Usharani, you have anything to add, please?
I'd like to thank you all participants for their good comments and suggestions, and we look forward it, and we are going to work on it, and thank you very much.
Okay. Dr. Usharani, you may briefly tell us about the Women, Youth and Rural Development Program that you are going to present
Yes.
today in CAF. Yes.
Yes. I'm also selected from CIRDAP. So I'm going to Kosi. And this aquaculture conference will be held on 21st to 23rd November. I'm going to present CIRDAP program on women and youth program, and I'll be there as a representative of CIRDAP. Thank you.
I want to add that we're trying to collect proposal from different countries, different organizations, and this proposal will be considered by a team of experts, and to comments and to a kind of guidance, prove the proposal, so that this proposal are good to receive funding support. The support may come from CIRDAP itself and also from donor organization, that we will request them to support this good initiative from different country and organization, and it planned to be implement on a yearly basis. Certain program may be more than 1 year, but we are going to administer this project every year. So this will be initiative that CIRDAP will be working on, and Dr. Usharani Boruah will be manager of these programs. So kindly support her and to bring about a good proposal from your countries and your organization, so that we could put them together in each year and be able to get some funding support from possible organization. Thank you. May I ask Uren to kindly make conclusion, please?
Yeah, thank you. Thank you so much for attending our webinar. Though due to the internet difficulties, some of the presentation of Dr. Usharani we couldn't hear, but I will put the PDF file, the whole presentation in website. Also, we'll share through our social media, also, so you can go through that presentation. And if you have any questions or suggestions regarding our women and youth program of CIRDAP, how we can elaborate that program, how we can do more activities under the program, you can send our suggestion directly to us. So thank you so much for attending. We will look forward to next webinar. I will send the invitation to all of you again. Hopefully you will all join. Thank you so much for attending webinar.
Thank you very much and have a good day.
Have a good day.
Thank you very much. On behalf of the Philippine government, I would like to thank Sir Churdsak Barapat and to all the members of the CIRDAP in inviting us. We are actually 7 coming from the different parts of the country joining in this webinar. Thank you.
Thank you so
Good
much.
day.
Thank you, sir. Thank you.
See you soon tomorrow.
Yes, sir.
Yes.
See you tomorrow.
Thank you, sir. Thank you.
Bye-bye. Bye-bye.
Bye, sir.
Bye.
Thank you.
Bye.
Bye.
Bye.